The primary assessment is a simple way to quickly identify if a life-threatening condition is present. It is the initial approach to anyone suspected of being ill or injured. If it is safe to do so, begin by checking for responsiveness. Tap or squeeze the shoulder and ask loudly, "Are you all right?" If unresponsive, have a bystander activate EMS and get an AED if one is available. If you have a mobile phone, use it to activate EMS. The speaker function will allow you to follow instructions, especially for CPR, from an EMS dispatcher while providing care. Quickly look at the face and chest for normal breathing. Take no longer than 10 seconds. If you are unsure, assume breathing is not normal. Weak, irregular gasping, snorting, or gurgling sounds can occur early in this type of situation. These actions provide no usable oxygen. This is not normal breathing. If the person is not breathing or only gasping, CPR is required. It is highly recommended for you to supplement your first aid instruction with training in CPR. However, compression-only CPR is an approach that is being widely promoted to people who are not trained in traditional CPR, which provides both compressions and breaths. Simple instructions in compression-only CPR can be shared in many different ways, including social media and as public service announcements. EMS dispatchers can also provide compression-only instructions during an emergency call. Still, compression-only CPR is a limited approach to treating cardiac arrest. At some point, rescue breaths are essential for all cardiac arrests, especially those involving an airway or breathing problem or those involving children. If the person is breathing normally and uninjured, place her in a side-lying recovery position. Place the arm nearest you up alongside the head. Bring the far arm across the chest and place the back of the hand against the cheek. Grasp the far leg just above the knee and pull it up so the foot is flat on the ground. Grasping the shoulder and hip, roll the person toward you in a single motion, keeping the head, shoulders, and body from twisting. Make sure the head ends up resting on the extended arm and roll far enough for the face to be angled towards the ground. Position the elbow and legs to help stabilize the head and body. Make sure there is no pressure on the chest that might restrict breathing. The recovery position helps protect the air passage between the lungs and the mouth by using gravity to drain fluids from the mouth and keep the tongue from blocking the airway. Frequently assess the breathing of anyone placed in a recovery position. The condition can quickly become worse and require additional care.